Hello, my name is Dr. Eric Green. I'm the Internal Medicine Residency Program Director here at Mercy Catholic Medical Center. Thank you so much for clicking on this video. Here we're going to try to show you some of the clinical highlights of our internal medicine residency. Our newest innovation was a reorganization of our schedule for the 2021-2022 academic year. Prior to this, we had a traditional schedule with blended inpatient and outpatient rotations. However, this year we moved to an X plus Y format. For those of you who are less familiar with that term, in an X plus Y format, residents spend dedicated time on inpatient rotations and dedicated time on ambulatory rotations. We elected what's called a 6+2 model. So we divided our academic year into 26 two-week blocks, where one block or 2 weeks out of every 8 is devoted to ambulatory, and the other 6 weeks are devoted to inpatient rotations or some blended consultative rotations. We did this really in response to feedback from our residents who felt like the tension of inpatient and ambulatory responsibilities was detrimental to their learning, as well as feedback from our faculty who echoed that this cadence of scheduling was really not simulating what clinical practice was going to be like. So far, we're incredibly excited about this change, as are our residents and faculty. At Mercy, our residents rotate at 2 different clinical sites. Mercy Fitzgerald Hospital, which is our primary part of Mercy Catholic Medical Center and is our primary or sponsoring institution, is the site of most of our rotations. Our secondary site is the newest part of the Hospital University of Pennsylvania, which is the Pupce campus. Pupce was founded in 2021 when Mercy transferred the former Mercy Philadelphia Hospital building to the University of Pennsylvania Health System. Currently, our residents rotate there for inpatient rotations on the floors, both day and night rotations.
Mercy is a community teaching hospital located in Darby, Pennsylvania, just a few miles from the Philadelphia city line. We proudly serve residents of West and Southwest Philadelphia, as well as the areas of Delaware County that surround our hospitals. Our communities include a wide spectrum of socioeconomic status and a large number of immigrants, many from West Africa. We are a safety net hospital that proudly serves as a primary care hospital for all of our local residents. Our patients come to us for conditions ranging from the common strokes, MIs, COPD, to the more exotic tropical diseases, weird and esoteric cardiac, pulmonary, neurologic, rheumatologic problems. As a full-service hospital with a full suite of medical and surgical subspecialties, we're able to treat our patients in-house with only rare needs to transfer to tertiary or quaternary centers.
Pupce is the former Mercy Philadelphia Hospital. It is a community-focused part of Penn Medicine that cares for the residents of West Philadelphia. Although it is distinctly a community hospital, it has representation of specialty and subspecialty medicine from the Hospital University of Pennsylvania. So our residents get to see the expertise of these nationally and many times internationally renowned specialists practice on patients close to home.
Mercy is also unique in that it is a resident-centered GME area. By this I mean we have no fellows. There's no fellows to steal the procedure, no fellows to monopolize the attending's time, no fellows to act as an intermediary between the resident and the board-certified attending who is truly their faculty member. We feel this direct attention to residents, while intimidating at first, provides them with the best learning environment because they have the ability to learn directly from all of their attendings. The hospital is a certified stroke and cardiac chest pain center, and we care for patients with all sorts of medical problems. Rather than describing all the things that we do treat at Mercy, I often like to describe the conditions we don't treat. For a number of reasons, we do not have pediatrics or obstetrics in our hospitals, so you won't be seeing kids, which in an internal medicine residency is probably good, and we'll have only limited exposure to pregnant women, as women in their third trimester typically would be transferred out to a facility that had on-site obstetrics. We do not do solid organ transplants or bone marrow transplants, nor do we care for patients with burns. Aside from that, chances are, if the patient comes in, we can treat them, and we do. Our floors have a wide variety of disease spectrum, ranging from observation patients to highly ill folks in step-down units. We've organized our inpatient teams geographically, with teams responsible for 1 to 2 floors, working closely with an attending, and also working closely with the nurses and other paraclinical staff who are based on a single floor in the hospital. Our ICUs care for our sickest patients and have the capability to do almost anything that they would need to, including advanced technology like intracranial pressure monitoring, continuous veno-veno hemodialysis, therapeutic cooling. Basically, if it's possible, we almost certainly can do it. Our ICU team is a group of residents who work together for a 28-day cycle. Over that 28-day cycle, they will rotate between day shift and night shift, experiencing all aspects of ICU care while learning as a team and caring for our patients. Our elective experiences pair our residents closely with an attending, often shadowing them not just in the hospital, but working with them in their ambulatory clinics. In this way, our residents get an in-depth exposure to a specific discipline and learn so much directly from our attendings. Our ambulatory experiences, both our continuity clinic and ambulatory blocks, have a dual purpose. We of course want to teach our residents the principles of primary care general internal medicine, but we also instruct them in the core principles of ambulatory care. We recognize that ambulatory care is a very different environment than inpatient care, where evaluations are thought of as taking months to years rather than hours to days. We are confident that the skill set we give our residents during the ambulatory rotations are useful to all of our residents, whether they go on to hospital-based medicine, subspecialty medicine, or primary care training. Our emergency departments are a fantastic laboratory with skilled emergency medicine faculty and a population of patients who present with a wide variety of complaints. Our emergency medicine has 2 aspects. On some rotations, our residents are acting as an emergency medicine resident, working directly with the emergency medicine faculty in initial evaluation of patients coming into the hospital from the triage. In our AOD, or Admitting Officer of the Day rotations, our residents act as the first contact for the medical service, screening and triaging patients designated by the emergency medicine physicians for admission to the appropriate level of care and initiating their care. We hope you'll explore the rest of our website and the other videos here to find out more about the internal medicine residency at Mercy.